Hi, I am Safa Al-Bajali. Our research project is talk about the extent of knee osteoarthritis patient adherence to the exercise and reducing weight in Mecca in Saudi Arabia. And the outlines for our research project is introduction and aim and method, results, discussions and conclusion and acknowledgement and reference. At the outset, I will talk about the introduction to this research. Knee osteoarthritis is a chronic disease characterized by the degenerations and the cartilage loss which results stiffness, pain, and limitation of movement. This is mean as a major public health issue because causes chronic pain, reduced physical functions, and diminishes of the quality of life. Non-pharmacological treatment should be used wherever possible. Exercise should be always attempted as the first line of treatment. Is one of the most common interventions suggested by the it follow international recommendations and relieve knee pain at all the stages of the disease. Exercise therapy is among the dominant non-pharmacological intervention recommended by the international guidelines. Furthermore, weight loss play important roles in the symptoms management, and it has documented the weight loss enhance the benefit of the exercise. There is 10% chance of this happening. The amount of the osteoarthritis in knee per kilograms of the body weight decreases. Vice versa, patients with the extreme knee osteoarthritis had more pain and a decreased health-related quality of life compared with the patient with the gentle moderate knee conditions. Inadequate awareness of the osteoarthritis and its associated risk factors has been documented among the Jeddah population.
Assalamu alaikum, I am Rima Saadi and I will talk about the aim. Our aim was to evaluate the lineage and adherence of patients with knee osteoarthritis to weight reduction and daily exercise. And in the method, we used a cross-sectional survey. The total duration of this study is 6 months. We collected data via Google Forms as the primary source of patient response collection and statistics analysis via SPSS. The total sample size, 200 participants selected randomly in the western region of the Kingdom of Saudi Arabia, adults between 30 up to 50 years.
Assalamu alaikum, I'm Zahran from group 3. I'm gonna talk about the result of our study. And this figure 1, the result shows relation between demographic characteristic, which is age, and patient adherence to weight reduction and daily exercise. And the analysis we did it by chi-square. And first we classify the groups into 3 according to age. First group, which is under 30 years old, and 2 which is from 30 to 49 years old, and third who are ages more than 50 years old. Then we ask patient many questions about adherence, and we summarize it into 4 factors. First question, we ask patient, well, when you started losing weight, did you notice a difference in the pain you felt? The highest response was from group 2. About 62 of the answered by yes, and 15 of the answered by no. Second factor about exercise help to relieve pain. The majority answered was answered by yes. And third factor is about type of exercise. As we see, the most responder prefer walking. Factor number 4 is about time spent exercising. And in first choice, about I do exercise rarely, we get 36 response from group 2. And in second choice, about I don't play exercise, we get high response from group 1, around 25. And in third choice, about 5 times per week, we get 12 response from group 2. And in fourth, we get 19 response from group 2. And in fifth, who do exercise once weekly, we get 14 response from group 2. Here in figure 2 shows the relationship between demographic characteristic, which is employment, education, and patient adherence to weight reduction and daily exercise. And in the analysis also we did it by chi-square. Here we have two groups. Group number one, employment, education status in the medical field, and the second group, employment, education status outside the medical field. As we see in the first factor about starting losing weight, we get 112 response from group 2. Answers was yes, and we get 31 answers was no from group 2. And in the second factor about exercise help to relieve pain, we get 106 response or answers was by answered by yes from group 2, and we get 44 answers was no from group 2. In the factor 3, it's about type of exercise. As we see, the majority of group group 2 prefer walking and low prefer walking more than football sport. And in the factor for time time spent exercising, as we see in all these choices, either do exercise rarely or don't play exercise 5 times per week, 3 times per week, once per week. The majority answers was from group 2, while we don't get any answer from group 1 in fourth choice, which is 3 times per week. We don't receive any response from group 1. And thank you for listening, and I hope you enjoy in this our research.
Hello everyone, my name is Suhood Al-Wadani. I will talk about discussion. In our community, patients with knee osteoarthritis rarely exercise, but when they do, they notice a difference in pain relief. As a result, about 53% of the participants had aware of knee osteoarthritis, and most think that there is a positive association between weight and knee osteoarthritis. Then realize the role of the medical team in educating the community about the importance of exercise and weight loss to improve community attitude. The number of responses is higher in females than males, and Mecca than in the other cities, so we recommend in future studies include more males and include more people from Taif and Medina.
Hello everyone. Before anything, I'm going to introduce myself. My name is Shayma Abdullah Mashari, and in our study conclusion, we found that the community's awarenesses of the importance of exercise and weight loss and a knowledge of the causes that reduce pain and symptoms of knee osteoarthritis is low. But they observe an improvement in relieving pain when they did exercise. Most of society like a walking attitude, and they notice the differences in the pain severity when they reduce their weight. So we encourage people to do exercise frequently and keep their weight down, and should focus on increasing health awareness campaigns to improve community attitude. We would like to acknowledge the pharmacy department and Dr. Arwa Farik and our family for helping and supporting us in this project. And this is our references. Thanks for your listening, and I hope you enjoy.